working in the UK were quite challenging. It was really daunting. Like the system was completely different. There were lots of things I didn't know how to do that I had to. I didn't have a choice. I don't think quitting was an option.
Yeah.
It's definitely going to be challenging when you start in the first few weeks to months. It doesn't mean you're not good. It doesn't mean you made the wrong decision. It's just a new environment. Oh, there was no single slot in Accra, like nothing at all in Accra. The next one to explore was Nigeria. So I think I would advise that you will struggle. That's the truth. It's a different environment. It's a different system. It was their ability to smile and be very polite, and at the same time not really like you and not really care about you. But with healthcare, you can't take any chances. So if you are not feeling up to it, make sure you share your concerns.
We are very proud of you, Uppermite. We are very, very proud of you. Hi guys, welcome to the Fame Blog for you. Today we have a very special and amazing guest here, and I believe her story is very inspiring and motivating. On this channel, we deal with such inspiring stories, and we are very, pleased and glad to have Dr. Gloria join us today on the Fame Blog for you. I believe her story is one of courage, growth, and purpose, and it's especially relevant for doctors and people in medical professions out there who want to take such path. So you are very much welcome, Gloria. Should I call you Gloria or Dr. Gloria?
Gloria is fine. Yeah.
Okay, you are very much welcome, Doc.
Thank
So
you.
yeah, we are very pleased to have you here on the Fame Blog for you. Could you please introduce yourself and give us a bit of background about?
Okay, thank you, Ernest. I'm also honored to be here. So I studied medicine in University of Ghana for 6 years.
Yeah.
And then I had my house job. That's usually like the internship or the foundation year equivalent in the UK. So I
Okay.
had that for 2 years. I had the first year in Kolebu. Then I had the second one in St. Dominic's Hospital, Akwitia. And then afterwards, I returned to Accra, and then I worked for as a medical officer for a while before completing the licensing procedure for the UK and moving here. Yeah,
Oh
I
wow,
think so.
wow.
That's just a summary.
Yeah, I can see it's been a long journey, from where you started and all that. So very well done, and a big
Thank,
congratulations to you for attaining all these feats.
thank you.
If I may ask, I know right now you are working in the UK, you are living in the UK. So, what
Yeah.
inspired you to actually make the move to, leave Ghana and then come to the UK to actually work?
Okay. Hmm. I think it's a number of factors really, but
Okay.
I think I wanted to experience a more efficient system. Yeah, that's what I would say. I
Yeah.
believe the medical training in Ghana, at least in my school, is quite rigorous, and Ghana has a lot of good medical doctors, but the problems are with the health system. A lot of gaps, a lot of inadequacies. Yeah, so it can easily make it tiring for you as a professional. So I think I got to a point where I wanted to experience a more efficient system, something that worked maybe slightly better here. I think
Okay.
I just wanted something better than what I had at the moment. And
Yeah.
I felt the UK would be a suitable option. Yeah. So I explored, I did some research. I had colleagues, senior colleagues who were already on that path. So I spoke to
Okay.
them. Yeah. I read things online and also weighed my options in terms of other values and family lifestyle choice and all of that. And I thought the UK would be a suitable a suitable choice, yeah, for the dreams I had at that point.
Okay, so thank you very much for such elaborative answer. And you made mention that you had like seniors who had already taken the step. So I think having, someone or people like that, really goes a
Yeah,
long way. Yeah, so
yeah,
I think
it really
it's
does.
really good. Yeah, I mean, you can pick inspirations and all that. So
Yeah.
that's okay. So I'd like to ask about PLAB. What was your experience with the PLAB and the whole process and all that?
So I wrote my PLAB in 2022. That was PLAB one. So that
Okay,
was maybe 3 years ago. Yeah. I think at the time, I'm sure things have probably changed a bit now. It could be better, it could be worse. I'm not so sure, but it was hard to get slots for PLAB one
okay.
in Ghana. Yeah, I mean there was like a mad rush when you open the website and you're trying to book. Within seconds, the slots are just
Yeah,
disappearing. So
yeah.
there was a mad rush for PLAB one slots back then, and so you are really lucky if you're able to secure a slot in
Okay,
in Accra. Because what happens is you've got a lot of African doctors who want to write, especially Nigerian and Ghanaian doctors who are
okay.
trying to book slots. So because apparently, I mean that was a story going around. I don't know if it can be confirmed. But apparently, Nigerian doctors also book into the Ghana slot because we are just
Oh,
close by. If they are not able to get
okay.
slots in Ghana, they can move in to
Yeah,
Accra and write their exam. So
I see.
it can be really hard to get a slot in Accra. Yeah. So at the time of booking, by the time when you join, you're given a number and you join a queue online,
Okay.
and then you have to wait. You're in like a virtual waiting room until it gets to a
Mm,
point where they show you the slot available or the seats available in the various cities across the world. So by the time it got to my turn, I mean, I saw Accra. There was a date somewhere in May or something, and it was just it just disappeared before I could
wow,
even click. It just disappeared, and before I knew, oh, there was no single slot in Accra, like
wow,
nothing at
wow.
all in Accra. The next one to explore was Nigeria, because at least Nigeria was quite close to home.
Yeah,
But I mean, I was also a bit scared of going there.
yeah.
They had a bit of slots in a few of their states. I think at the time I didn't find any slots in Abuja
Okay.
or Lagos, but they have a few other states. But I wasn't too sure, so I didn't
Mm,
go for that as well. Then I found a slot in Kenya.
okay. Oh,
So there
wow.
was a slot in Kenya. Yeah.
Yeah,
There was a slot in Kenya much earlier. So the thing with the slot is that apart from the difficulty with securing, even if you're able to secure, the date is quite far back than you would like. Maybe you
yeah.
intend to write maybe 3 months, but the date is like 6 months or 9 months. And that can affect your planning because you need to write your PLAB one, your PLAB two, plan and do whatever you need to do to move abroad. So I
Okay.
was really I found that slot in Kenya,
Yeah.
which was February. So that was really great for me. I mean, the timing was good for me. It just
Okay.
meant that I spent more because I would have to travel to Kenya, pay for my own accommodation, pay for my own upkeep just to write the PLAB 1 exam. So that
Yeah.
was the challenge with writing in Kenya. I had to sort of pay extra aside the fee. And if I had written in Accra, I would have just woken up one day, picked the car and gone to the location to write. But I had to fly out of Ghana to Kenya to go and write the exam. So yeah, that was the
Wow.
experience one. Yeah.
Wow. Wow. That's a lot
Yeah.
of sacrifice, all the way from
It
Ghana
was
to Kenya to just write an
yeah,
exam.
yeah.
And do you have just plum one and plum two, or you have like more
So we have PLAB one. There is PLAB one
plum one?
and
Yeah.
there is PLAB two. Yeah. So
Yeah.
you need to pass PLAB one and two to get the GMC license, and that's like the standard. But I
Okay.
think currently they are shifting to a new name or new system. But I don't
Yeah.
have any details on that. But I think the last time I checked, it was still PLAB one, PLAB two. Yeah.
Oh, okay. Okay. Amazing. Yeah. Thanks for the insight. And
Yeah.
I mean, you've experienced working in Ghana and also experienced working in the UK. So if you have to mention one big difference between working in Ghana and UK, what would that be?
Hmm. I think in the UK there are guidelines for everything, and that's
Yeah.
the major difference. In Ghana, you find a lot of people doing what I would say freestyle, or or a
Okay.
lot of people doing things here. But
Yeah.
it's not like that here. It's really different here. Everything has to be
Yeah.
guided by the guidelines already available. Whatever you
Yeah.
do, you need to make it. You need to make a sound defense for whatever you're doing. Like
Yeah.
if I'm giving you this medication, I need to be able to prove why I'm giving it to you. So
Um,
it's heavily based on guidelines, and that is, I think that's the biggest difference.
okay.
Ghana has its own guidelines, but obviously it's there are many areas or many aspects of the care provision that is not based on guidelines.
Yeah.
There are very vague guidelines of some sort. So
Um,
depending on where you find yourself, treatment might be very different. If you
o-
find yourself in a hospital in maybe Sunyani versus a hospital in Accra, things
yeah.
might be very different
Okay.
because it would be based on availability of the resources. It would be based on the knowledge of the doctor seeing you
Yeah.
versus health providers having clear guidelines across the board, and they following these guidelines to provide services for patients. So I think that is the key difference. That's the key
Okay.
difference. But
Okay. So in
yeah,
the UK, there's more like policies or paperwork, as you know, opposed
yes,
to Ghana.
exactly. A lot of
Makes
paperwork, a lot of policy. Almost everything you can think of, there might be a guideline for it. So
Yeah.
if you coming from Ghana and you move here and you you still have the that mentality that, oh, I want to help the patient, I want to do this for you, or I can do this, why don't I do it? You might
Yeah.
need to be cautious because
Yeah.
you might do something that might be acceptable in Ghana, but it would be completely inappropriate here because you need to follow the guidelines. And
Yeah.
at the end of the day, nobody really cares that you are trying to help. If something
Definitely.
goes wrong, nobody
Yeah.
really
Yeah.
cares. Is the question is, did you follow the guidelines? Are you
Yeah.
trained to provide that service? Are you in a position to provide that service or do whatever you did? So that's what really matters. Yeah. But in Ghana,
Yeah.
I guess a lot of times we do our best to help patients because of poverty, because people are not able to pay out of pocket. So
Yeah.
doctors might bend backwards, or even nurses might bend over backwards for patients. But
That's
here,
true.
you just can't do things like that. Yeah.
Yeah. Oh, okay. Okay. Yeah. Thank you very much for such important tip because if someone
Yeah.
is, planning to make this move, at least they know how things work out here. So
Yeah.
instead of coming with their own ideologies and all that, they will have some perspective in terms of that. So I really
Yeah.
appreciate throwing light on that. And I know moving from, let's say, Ghana to the UK or anywhere at all can be a very daunting experience. It can be very difficult in terms of cultural
Yeah.
shock and all that. Yeah, I mean, I've experienced so many, cultural shocks. Even till today, you still see certain things and you are like, oh my goodness, what's happening here? So
That-
can you give us a snippet or let us know how your first week in the UK was? How was it like, and is there anything that really shocked you,
Oh, well, I think hmm, I'm trying to remember if there was anything in particular that shocked me.
Okay.
I'm not sure I would say shocked. I mean, I
Mm,
get the meaning of cultural shocks, but I wouldn't say I was very shocked. But I
okay.
think that one thing that I found a bit weird was their ability to smile and be very polite and at the same time not really like you, and yeah, and not really
Yeah,
care about you. I found that a bit a bit a bit weird when but I realized they were just being polite. They were just
yeah,
trying to be friendly, to have a friendly face for strangers. It's You
yeah.
don't need to read too much into it. Yeah. So if someone is smiling at you, it doesn't mean you are their friend. Yeah, they are
Okay.
just being polite. So unless you've actually had that a relationship with that person or that closeness with that person, you don't need to assume or try and maybe be aware
Yeah.
of boundaries, and don't take things at face value. Don't just think that they
Mm.
are smiling, they are saying you're right, you're okay, so they are your friends. Yeah.
You're right, mate.
Yeah.
And you would think they are
They're
so
just
cool
being
with you.
polite. Yeah.
Yeah,
Yeah, I think
yeah,
yeah, in the beginning I found it a bit weird, but I also realized that is one of the beauty about their culture,
yeah,
that
yeah,
they are
yeah.
so polite and friendly to even strangers. You might be on a bus having a bad day and someone just says
Mm-hmm.
hello to you. It's kind of
Yeah,
nice. Yeah, it can be nice.
yeah.
So you
Definitely,
just need to,
definitely.
yeah, I just need to be aware of that. Yeah.
Certainly, because let me chip this in. When I moved
Yeah.
from Germany to the UK, there's that
Mm.
cultural difference. So in Germany, they are very like straightforward. They don't do small talks and all that. But here in the
Yeah.
UK, even a meeting that takes 30 minutes, they'll use 15 minutes to just say, "Hiya, how was your weekend? How was this? How was?"
Yeah.
Yeah. So
Yeah.
I think
They love
like,
small talks
yeah,
and chit
yeah,
chats.
yeah.
They do.
And being polite. They might not like you, but
Yeah.
they'll still smile and
Yeah.
yeah. So definitely,
Mm.
I agree with you on that. Thank you very much once more, Gloria. Um, I mean, you've taken us through the process, everything, and how you were able to get to where you are today. So, were there moments where you doubted yourself, or you felt like this is too much? I need to take a break, or those kind of stuff, because we don't want to be painting just the gloomy or the all rosy picture. You get it? So, were there moments
Mm.
where it felt a bit challenging and all that?
Oh, it definitely did. I mean, my first few weeks when I started working in the
Yeah,
UK were quite challenging. It was really daunting. Like the system was completely different. There were
yeah,
lots of things I didn't know how to do that I had to learn from my colleagues. So it was definitely challenging at the beginning. And I think in my first few months, I questioned why I had even moved here in the first place. I wondered if that was the right decision, because everything was completely new, a lot of things. I had the knowledge, the clinical knowledge, but you're in a
yeah.
system where they do things differently. It's not just about having knowledge or skills. You need to know how things work. After you've seen a patient, well, where do you send them to? What do you put in their notes? Which GP are they going to? A whole different system that you have no idea of. So it was quite challenging in the beginning. But slowly, I got to the point where I started to feel confident again. So I think it's normal to feel like you're out of place. It's really
Yeah.
normal to ask yourself questions about why you're even there in the first place. But
Yeah,
it's just because you're in a new environment. It's unfamiliar. It can be a bit hostile as well.
yeah.
It is important to give yourself grace and ask for help if you're struggling as well. So I think that was a key thing for me, that in the beginning I made them aware that I had never worked in the NHS. I
Mm-hmm.
asked for a shadowing period. You need to speak up for yourself. So I asked for a
Okay.
shadowing period. So shadowing means you're going to, in your first few weeks, they're going to let you um, go along with a colleague or shadow a colleague, see what they are
Okay.
doing and pick up things and how to do things yourself. So they don't just throw you out
Is it
into the
like
jungle to, yeah.
supernumerary? Do they call it supernumerary or?
Yes, so for the first few weeks, you would be on the roster, but you would be supernumerary. So they would have someone to cover you or to do the role that you would have done, but you'll be there to learn skills and see how the system works. So
Okay.
it was quite useful, yeah. So I think I would advise that you will struggle. That's the truth. It's a different environment. It's a different system. So unless you're already working in a system that's similar to the UK or you've
Okay.
worked here before,
Yeah.
it's definitely going to be challenging when you start in the first few weeks to months. It doesn't mean you're not good. It doesn't mean you made the wrong decision. It's just a new environment.
Yeah.
If you need help or you think you need some period to adjust to settle in, let them know and take that time. It would be really helpful. Go a long way to help you avoid mistakes because
Yeah.
you're in healthcare provision. It could be a very small mistake, but with healthcare, you can't take any chances. So
Of
if
course.
you're not feeling up to it, make sure you share your concerns and get the help you need.
Wow. 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 Thank you very much. I mean, I'm learning a lot today. Yeah.
I'm glad you are.
Definitely. We are all learning, It's a
Yeah.
privilege to, listen to such bright minds and all that. So I'm definitely
You,
learning a
you
lot.
flatter me.
Oh no, 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 no. I
Thank
mean,
you.
back in the days we were like, we don't want to, give history, but yeah, I mean, we are very proud of you. Uppermite. We are very, very proud of you. Yeah.
Thank
So
you,
just
Ernest.
keep on going and keep on pushing. And the Lord, I believe, will do, marvelous things with you and all that.
Amen.
I understand, you mentioned a lot of challenges. So can you mention one thing that kept you afloat and then kept you motivated to keep going?
I think that I've been blessed to to have support
Okay.
at different points in life, and I think the main thing, I would say the main person was my partner, who is now
Okay.
my husband.
Lovely.
Yeah, so he's been wonderful and he was really, so he wasn't in the UK even then, but he would come around. You're in a new environment, a new place, and I'm
Yeah.
also a young woman. It
Hmm.
can feel very unsafe and all
Definitely.
of that. So it was wonderful to have him here. I think my faith also played a role. My faith also played a role. I
Yeah.
mean, I believe that I didn't get here by mistake. It wasn't a mistake that I moved to the UK. So that kept me going, even when things were difficult. I
Yeah.
knew there was a reason for me coming here. So I didn't have a choice. I don't think quitting was an option for me. Yeah,
Yeah.
quitting wasn't an option for me, especially because of the kind of job I was doing. So just a little story. So the job I'm doing is a training job. So
Okay.
it means that there are more expectations of you. So
Yeah.
when you're in a training job, you have more expectations because aside from just working as a doctor, there are certain I would say academic or criteria you have to fulfill every
Okay.
couple of months or every year to progress. So I had really high expectations right from the
Mhm.
start. So I didn't
Wow.
have time to play around or to say that, okay, let me take so much time to get used to the system. So it was
Yeah.
really hard. I think these things really helped me, my faith, my partner, and keeping close to my family. And last thing I would say is finding a community has also
Okay.
been helpful. I think wherever you
Amazing.
find yourself, it's good to have a community. It could be
Hmm.
church, it could be colleagues from work, or yeah, people in where you're living. If you're able to find a good community, it will be really helpful. Yeah. So I
Yeah.
think
Yeah.
to answer that, yeah.
Wow. Wow. Yeah. I completely agree with you because having that support system, can go a long way because in
Yeah.
this Western world, depression is very real. it can feel very lonely sometimes. So, having that partner, that family member, that friend, I think is a really good thing. So,
Yeah.
yeah, definitely.
It's
Cool,
what
cool,
will
cool.
help your mental health.
Definitely. Yeah, 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 yeah. For sure, for sure, for sure.
Yeah.
Okay, Dr. Gloria, so if you had to start all over again, is there something you would have done different? So
Yeah.
assuming you are to advise your little self who was in Ghana a couple of years ago, what do you think you would have done differently, or what advice will you give to yourself, or will you give to someone out there that could help the
Yeah.
person progress in their career as a medical doctor? I hope it's clearer.
Yeah, it's clear.
Okay. Yeah.
To be honest, I'm not sure I would do anything differently. I think I had good medical training. I think
Okay.
the medical training I received is was really good in Ghana because a lot of Ghanaian doctors travel all over the world, and they still do extremely well. So it tells you that the training is at least is up to standard. So I
Yeah.
don't think I would change that. Yeah, and I think I enjoyed my house job years in Ghana. The
Okay.
first few years was nice. I made friends. I went on dates. I hang out with my colleagues. I experienced a lot, so I think it was really nice for the time. It was worth it. I don't think I would have wanted to come quickly to the UK because
Yeah.
it's not my home. I grew
Yeah.
up in Ghana. I
Of
had my
course.
friends. I was living with my parents, and I really enjoy the company of my parents, coming back from
Yeah.
work to have a chat with them, to find my mom had made me food. So I feel like it was, yeah, it was,
Yeah.
I think I enjoyed it anyways. So I don't think I would have wanted to come to the UK. I feel like I came when the time was right. Yeah, and
Yeah.
and
Yeah.
I came when the time was right. It might be different for others, but I feel like
Definitely.
every experience mattered to me, and
Sure.
I came at the right time, and I hope I continue to enjoy my stay here and
Definitely.
wherever
You
God.
will enjoy. Yeah. You definitely enjoy. You just, need to, be safe, mind your business, continue doing your thing, and you are
Yeah.
good. So yeah, and
Thank
you will definitely enjoy. Yeah. Okay.
thank
I
you
think
so
we need
much.
to start drawing the curtains. It's been very insightful, and we can go on for the whole day, the whole week, the whole month, because I know you have a lot of insight and knowledge and information and all that, but we are trying to keep it a bit short and not too long. So
Mm.
at this point, do you have any final words, advice to someone out there who wants to follow a similar path?
Okay. I think that's, I mean, I gave a bit of information about PLAB 1, PLAB by, I mean, there are other things I didn't talk about. I didn't talk about the process for PLAB 2. I didn't talk about other exams you can write if you want to increase your chances of securing a job in the UK. So there
Yeah.
are other things to do. You just need to do your research, and I think you need to I think a lot of people, when they are considering traveling abroad, for most people it's about the money, but I think that you have to have a holistic approach. You have to look at other things as well. Look
Yeah.
at the kind of life you want, where you see yourself in a few years.
Hmm.
Does this country align with your values, with your
Yeah.
beliefs, and what you want in life? So I think it's important. UK is not the only option for doctors and for young professionals in the healthcare industry. There are other countries. There's Australia, there is US. Just make sure you do your research, explore, weigh your options, see what
Hmm.
is suited to your needs and your values as a person, and hopefully God will give you the strength and bless your efforts as well. Yeah.
Oh my God! Wow!
So that's my
Wow.
advice.
Amazing. Lovely, lovely, lovely. Thank you so much, Gloria, for
Thank
coming
you
on
for having
this channel, for sharing your journey, for being honest with us. It's been very inspiring and very, hands-on and practical. And I know a lot of people are going to benefit from this video. So for this, we wish you the very best in your career and in your personal
you.
life. Thank you very much. And
Thank you so much.
guys, if you found this video helpful, don't forget to subscribe, like, comment, and then share. Let us know if you have any question, and then I'll contact my senior woman here and then give you a very practical answer. So thank you so much, Gloria.
Thank you so much, Ernest. It's been wonderful. I think I've really enjoyed this interview. Yeah,
Amazing,
I
amazing.
felt I felt a bit nervous at first, but I think it's
Oh,
just like having a chat with an old
oh yeah,
friend.
yeah, 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 yeah,
Yeah.
yeah, yeah.
So
There's
thank
nothing to
you
be nervous
for the
about. Yeah.
wonderful work you're doing.
No worries. Thank you so much. I mean, we are trying our best to, help our brothers back home and those here who want to, change career and all that. So I'm very glad you came on board when I spoke to you. You didn't hesitate. So I would say a very big thank you and may God, bless you. Thank you
Amen.
very much. Thank you very much. And enjoy your
Amen.
evening. Bye.
Thank you.
Thank
Bye.
you. Bye.